And while those vaccination rates among healthcare workers are on the rise, staffing shortages continue to affect Maine's care centers.
Shortages like those facing Central Maine Medical Center, which forced the hospital to suspend certain procedures this week. News Center Maine's Sam Rogers is following the latest developments on this. And Sam, it sounds like staffing was an issue at CMMC long before the pandemic even started.
Yes, Pat and Amanda, that's exactly right. The staffing issues are nothing new. In fact, we were able to go back through years of our own reporting and found the issues facing our healthcare system today are the same problems that faced it decades ago. It's just that now, even losing one employee hurts a lot more.
Within the next 10 years, it's predicted that about 55% of the existing nurse force is expecting to retire.
That was Dr. Barbara Higgins, the chair of nursing at then Husson College in 2007. The problems 14 years ago sound very similar to what they are now.
A really quite dire need for nursing faculty in the programs that will be educating these students.
Back to present day.
We need more nurse educators so that we can educate the nurse of the future.
Dr. Colleen Koob, the Dean of Nursing at Beale University, interviewed Wednesday.
It's hurting this state and it's hurting everyone.
The staffing issue hurting Central Maine Medical Center in Lewiston the most right now, as enforcement for the state's vaccine mandate looms.
The staffing issues at CMMC are not going to go away with a brief extension or a change in the mandate.
Senator Ned Claxton, a Democrat, was part of the group of local lawmakers approached by hospital leaders last week, looking for support. Claxton says his focus is bringing options to the table to help his hospital and his community.
What we were looking for is things that might help immediately, such as getting some help from the Maine National Guard to do non-clinical duties.
And asking for help to assist the hospital with its Medicare payments.
And that comes at an obviously bad time if they're busy with a hospital full of people with COVID and can't staff all their beds.
The pandemic bringing an issue existing for decades to rock bottom. Koob says it's because of the COVID-19 burnout, vaccine mandates, and an overworked workforce. And she's worried about her new grads.
When they're thrown in and there's worker shortages, are they getting the mentorship that they need?
It's a very similar story across Maine nursing homes. Many were forced to close their doors in recent months after officials expressed similar concerns more than a decade ago when we interviewed this nurse.
A lot of people that work in this profession are compassionate, caring people, and that's what we want, taking care of our loved ones.
And these staffing issues even go back to 2002, when we reported nursing shortages were a concern back then. Today, Governor Mills told reporters that the state is working on increasing the pay of various healthcare workers and is giving hospitals more funds to increase pay or provide bonuses or some sort of sign-on bonuses that kind of attract a workforce. And we asked an executive at Northern Light Health, which owns both Eastern Maine Medical Center and Bangor. And Pat, we're going to toss it back to you.